Hey, everybody. It's nice to see some familiar faces and some new faces here. And I look forward to chatting with anybody that wants to chat. So as mentioned, I am first and foremost a rare mom. I think once you have that title, that's your title, right? That's the hat that you wear all the time, sometimes in addition to other hats. I had two sons with Duchenne muscular dystrophy who were diagnosed in 2002. So that makes me what we call in our community one of the OG moms, and that's probably the nicest thing they call us in the community, right? So my sons were diagnosed in a time where there was no hope, no help. This was a time where the diagnosis came with an absolute death sentence. At the time we were living in Vermont and traveling far and wide to find doctors and physicians and hope for my two sons. In 2012, we found that, and we found that based on a clinical trial run by a company that still exists here in Massachusetts. If you ever turn on your television, your radio, open a newspaper, you know about Sarepta Therapeutics, right? So we entered the study at a time that they were AVI Biopharma, though. So I've been through 3 CEOs in that company. I'm actually one of the oldest members of the company, having never worked there. They have me as an honorary member. But my son Max was 9 years old at that time, and my son Austin was 12 years old at the time. And Max was able to get into the study, but Austin wasn't, because Austin was no longer walking. And we all know, those of you who run studies, you know that there's usually a line in the sand with the progression of the disease. That's really what launched our family into our 15 minutes of fame and our long advocacy road that led me kind of to this chair right here. I was just a stay-at-home mom who saw one of my kids getting better on the new therapy, and saw one of my kids who needed the therapy more getting worse. And as Max got better, I was looking for a way to share my experiences with the world and with people that needed to understand that we needed to get Austin this drug as soon as possible. I'll spare you sort of all of the details of the work that got us into the limelight, but Max was doing incredibly well, and we spent a lot of time trying to figure out who the decision makers were. And that's what led us to advocacy, lobbying, both on the state and federal level, not as registered lobbyists, but as a family. I have many, many photos and videos of us parading Max off to DC to stand on a stage at briefings at 10, 11, 12 years old, sitting in drug utilization review board meetings post-drug approval and talking about the impact of drug on himself. Max became a very great advocate at that young age. Eventually, Austin was able to have access to that drug, but it was a 3-year delay. And so with 3 years living with Duchenne muscular dystrophy, he had gotten worse and he had progressed over time. Austin actually passed away in February of this year at the age of 26, which is old for Duchenne, right? I was told that they wouldn't live into adulthood. And so the fact that they were able to get treated with this exon skipping medication that later became the first approved drug was incredibly important. I learned at that time, though, that the drug approval happened, that approved doesn't necessarily mean access. And so I became an expert in something beyond the regulatory system, and that's the drug utilization review boards and P&T committees. Not just one, but pretty much every one. In every state, we went on what I call my DUR roadshow, and we met with families in every state that were looking to have access to the new therapeutic, and brought our kids. We brought those that had benefited from the drug to be able to speak to the benefits of the drug. And we got to know these different states really well, and what they do well and what they don't do well. But we found that 100% of the time, if families were able to have access to decision makers, decisions came out better, policies came out better, because everybody wants to do the right thing, right? Everybody wants to help save lives. You're not in a public servant position unless you want to serve people, or at least that's what I'd like to believe, that everybody is human and everybody wants to help patients. And so that's what we did. We showed up and we showed out for all of these different events. We've been incredibly lucky to be in a place like Massachusetts where we are able to show up and we are able to advocate. Max went to a DUR meeting in Massachusetts, and I'd like to believe that's why he has access to exon skipping therapies right now, because everybody knows kind of who he is. As I kind of grew up into my advocacy, I started a company. I run a company called Canary Advisors, and I always tell people that's just me making a living doing the thing that I love, right? So I have kids to feed, not only my older son Max, who's still living with Duchenne. I also have a 17-year-old who was diagnosed at the age of 10 with common variable immune deficiency. The joke in our family is that his brothers got way too much attention, so he had to get really sick and get his own rare disease so that he could actually come up and get a little bit of mom's attention. My older son Austin was a sit-down comedian in Boston, and he says that unironically. And he used to say that the boys launched my career. The only reason that I knew anything was because I had sons with Duchenne muscular dystrophy. And he thought that James was just helping me to expand my career into other disease states, so I could kind of launch into the autoimmune world. And I also have a daughter who at this point is healthy, 14-year-old. I'm a public servant here in Massachusetts. I do work for the state, not in any of the offices, but because I'm a foster parent, we are employed by the state as foster parents, and I've adopted a 5-year-old out of foster care, and I currently have 2 other little kiddos in foster care. So Canary Advisors is my company, and really it just feeds kids because these kids eat a lot. But what we did is we monetized the value of patient engagement. So we believe heavily that in order to be in a place where decisions are being made, you have to raise up your voice and be part of that. And one of the ways that Massachusetts has been really successful in doing that is with the formation of our Rare Disease Advisory Council. I think there are a number of states that have a Rare Disease Advisory Council now. It should be all the states that have a Rare Disease Advisory Council. I've been on the council since its formation. We've been able to accomplish things like kind of looking into the newborn screening committee and being part of the newborn screening committee process and actually improving that process. I'm happy to say that through a legislative effort last year, we were able to put Duchenne on the newborn screening panel in Massachusetts, which is a huge accomplishment, and no other family should have to wait 3 years for a diagnosis like I did. My older son was 3, Austin was 3, and Max was a newborn when they were diagnosed. And so now in Massachusetts, when babies are born, they should have a diagnosis immediately, which helps you get to those treatments. And then the last thing that I'll say is that, with the Rare Disease Advisory Council, we're also really interested in making sure that not only is Massachusetts the leader in innovation, right? All of these products are coming, most of these products are coming from Massachusetts and from early investments and from really smart people, but we also have to be the leader in access. And that has been a challenge in the state that the Rare Disease Advisory Council and that my family is really working on. We're working on transparency so that when a rare disease is going to be reviewed at a drug utilization review board, there's 30 days notice, and people have the opportunity, like Max and I did, to come and to speak about what they care about. We're also working to make sure that that there's coverage, that coverage happens with an FDA-approved drug and they don't have to be relitigated. So there's always room for improvement, but I'm incredibly grateful to be here. I'm grateful to have made a career out of what was important to my family. And I'm grateful to my son, if he's listening to me, because yes, indeed, he absolutely drove everything that I do today, and I continue to do in his honor.